Absolutely. And that's why we have the divisional coordinator, Lagos Division of Ilera Eko. Basically, he's here, Mr. Peter Adejo. Hello, Mr. Peter Adejo.
Good morning.
Good morning.
Good morning. It's great to have you in the studio.
I could call you Peter.
Yes.
Oh,
Right.
awesome.
Fantastic. Well, I mean, today's focus is Ilera Eko Standard JAARA Health Insurance Plan. First of all, what is this about?
Okay, Ilera Eko Standard JAARA is a new plan that was introduced by Mr. Governor of Lagos State last year.
Okay.
So under this plan, we have a different package such as a family of 4, family of 6, and individual plan.
Okay.
Did you want to break it down into what each one has to offer?
Okay, individual plan only covers for one person.
Okay.
So and it's 15K per annual.
15,000 per
50,000
year.
per annum,
year,
yeah.
And for a family of 4, that is a husband and wife, 2 children. It can be only husband and wife. It can be husband and wife, one child, or husband and wife, 2 children, which is 55,000 per annual yearly too. Then the family of 6 start from husband and wife, 3 children.
Okay.
The maximum is
4
8.
children.
The 4 children and husband and wife. That is total 6. But additional of that 6, you pay extra money
Okay.
for it. Yeah.
Okay, so anything after 6, you're going to pay extra money.
Extra charge of
Interesting.
10,000 naira.
Okay.
Per
So what are the health benefits? What do you gain to stand to gain when you
Thank you
are
for
part
that.
of this?
So I'm single, for instance, 15,000 naira for annual plan. What does that cover me?
It covers general consultation
Okay.
in the hospital.
Okay.
It also covers running a test in the hospital,
Okay.
prescription of drugs,
Okay.
15 days admission in the hospital.
Wow, 15 whole days.
Exactly.
Okay.
In
So
a year.
it covers eye care and dental care.
Nice.
Okay.
Dental care,
And
eye
eye
care, tests, medication, and 15
Consultations
Malaria,
as well.
typhoid, all
and
those,
15 days of hospital stay.
Does it cover any
Wow.
surgery whatsoever?
for individual plan, no, but for family package,
Okay.
the one of family of 4 or family of 6, it
6.
covers surgery.
So what
So-
else again does it cover in family of 4?
A family of 4 covers antenatal for pregnant women.
Okay. Okay.
It covers delivering, both normal delivering or CS.
That's
So these are the additional package that is included in family package.
The standard JAARA.
Yeah, standard JAARA in standard JAARA, yes.
Okay.
Like it. So when we think about some of these costs, they look quite affordable. The other question would be, what hospital can I go to? Are there particular hospitals I must go to, or how does that work?
Thank you for that question. We have different hospitals, both government and private hospitals under the scheme.
Ooh.
So if you register under the scheme, or sometimes we do send to some of our enrollees
Okay.
to choose, and we always advise them to choose any hospital that is very close to you in case of emergency.
Okay.
But you have the chance to choose any hospital you
hospital.
like, whether it is close to you or far away from you. Just choose anyone. We have both private and government hospital.
In total, how many hospitals do you think, like, does Ilera Eko have under the
We have more than 400 to 600 hospitals under this scheme.
400 to 600 hospitals
Yes.
in Lagos alone?
Yes.
Oh, that's fantastic.
I like that they advise you to pick a hospital closer
Close
to
to
your
you,
home,
just
because
in
in
case.
case there's an emergency, the
can
closer
easily-
the hospital is, the better. What else do we need to know about this standard JAARA plan that, a lot of people don't know about, but they should have an insight on?
Some of the things that we need to know more about the standard JAARA plan is telemedicine.
Tell us about that.
Tell us.
Telemedicine is if you cannot go to the hospital, you can be at your comfort zone. We have a number that you call. You talk with a doctor. If something that you need to go to hospital, the doctor will advise you, or if something that you need to go to a pharmacy to go and get drugs, they will
Okay.
advise you on that issue.
So it goes beyond you showing up at the hospital. You can actually do calls.
Yes, call
and,
from your
a
whether in
doctor
your
would
office.
speak to you?
Yes, exactly.
well, that's amazing. Well, you can join in on the conversation. Tell us what your thoughts are on this. If you have any question for Mr. Peter here, well, now is the time to ask. 0705 6900927. 0705 6900927. Remember, it's Ilera Eko right here on your One Family One radio station, Super 92.7.
So telemedicine.
Mhm.
Does that apply for everybody under standard JAARA? So, remember, I'm single, 15,000 naira my per annum. Does that cover me too?
Yes.
That is so I can just be in my house if I feel a headache, could call the doctor.
Yeah,
and
if I
speak to a
freak out
doctor.
about hospitals, then I could call the doctor. The doctor can now advise you.
But does it cover ambulance as well, just in case there's an emergency at home? Any of these plans?
The family
Standard JAARA?
package covers ambulance.
Okay.
Yes.
Wow.
I mean, there's so
This
much.
is so cool. I know.
All right, the
So,
phone
okay, we
lines
have
are
phone
buzzing.
calls. Hello, good morning.
Good morning, this is Mr. Matthias Ayuba calling from Badagry.
Thank you for calling, Mr. Matthias Ayuba. You're on Ilera Eko. Do you have a question for our guest?
Thank you so much. I heard about the single package,
Okay.
Okay.
and you people asked Mr. Peter, whatsoever his name, the covers of the single package, and he made mention and also about the surgery. What happens if a single one that has that package and it could not have access to surgery? We just want to know because he made mention of the family of 4, 6 that cover surgery and other because of the JAARA or whatever happened. I
Okay,
just know
okay.
That's why I'm asking to know why is it that a single package could not have access to that surgery if the issue come up.
Okay.
Okay.
All right. Thank you
Let
very
me
much,
let
Mr.
yes.
Peter.
Thank you
Over
for
to
that question, my brother. I said earlier, the difference between the family package is in areas of surgery. Now, the individual package, we have a limit in areas of surgery. While family package has more benefits if you're under family package. So, and if you are under individual package and you want to go for any surgery, we have a customer care. The hospital need to confirm from the head office to know whether the surgery you want to go is covered by the individual package.
Okay, so there are some surgeries that are covered by the individual
Yes,
packages.
not all
Not
surgery.
all surgeries.
Exactly.
I
Okay,
want to
so
imagine minor surgeries.
just
are
minor
covered.
surgeries.
Yes,
of,
exactly.
okay, so nothing major
Yes.
that covers.
So, Matthias, the other thing you can do is probably register a family package, even if you don't have a family at the
Yet.
You even have family now.
You have family,
If
yeah.
you do it, you can do it ahead for your parents, for your siblings.
No,
If-
even if you don't have a wife, or you can register and include some of your siblings,
that's the
Right.
point.
as long as they are not more than 23 years.
Ah,
Because we have
that's
terms
an
and conditions in that
interesting
area, like this, and in areas of family package, the maximum age for the children is 23 years down.
Okay,
Oh,
so
exactly.
after
That's
23,
good.
you have to
You
register
have
as an
to
individual.
exactly.
Okay,
because
okay.
you are a full-blown
Okay.
adult.
Yes.
All right, you can send in your questions on WhatsApp as well. 0705 69000927 is the WhatsApp line, or via text on 090.
090-3714-2798. That is 090-3714-2798. Okay.
Well, I mean, more questions are up to be answered. How much does the plan cost, and are you allowed to pay in cash? How is the process of payment? Do you, especially if we're going to talk about those that are working in an organization and those that are trying to do it directly with Ilera Eko, can you pay in cash? What's the process of payment?
You can't pay in cash.
Okay.
It's highly prohibited.
Okay.
It's either you visit any of our office. Our
Okay.
head office is located at the Good Shepherd at Alausa, opposite Secretariat.
Okay.
Alausa, or you visit any of our divisional offices. We
Okay.
have 5 divisional offices across Lagos.
Okay.
One is at Badagry. We have another one at Ekbe, another one at Ikorodu. Then Lagos own is located at Aja,
Okay.
BRT terminal.
Okay.
Then we also have another one. So we have some kiosks. So that is why if you cannot go to the bank, you go to any of our divisional offices and use our POS.
Okay, so cash is prohibited.
It's
You must make
prohibited.
payments via transfer or
Exactly.
with your card.
Or
Okay.
you pay online.
Or you
We
pay
have
online.
a link that you can use and pay online.
Oh, could you give us that link quickly?
Maybe
Okay,
I'll
we
send
can,
it to you.
yeah,
Okay,
you have to send it to us. So someone has a message, Peter. He says, please, any plans for an SME for his staff? So if, as an SME business owner, if I want to put my staff on a plan, is there anyone that allows me a health plan for my staff?
Yes, you can register your organization under the scheme.
Okay.
And they are coming in form of under your organization, meaning that you'll be the one that will be paid for them, or the organization will take care of any of their
Health
payment
yeah,
bill.
needs.
Yes.
Expenses.
So as many as you can register under the scheme, and they'll register the name of the organization under the other Lashma portal.
I'm curious as to the cost of that because it's different from this standard
It's
JAARA
still
plan.
the same thing. The only thing is that if you're going to make the payments, you're paying for all the organizations. It's either you choose individual, like I have some organization that I register.
Okay.
Some of their staff are not yet married.
Okay.
Those
So they do individual plans.
They do individual plan. Why the ones that are married do the register under family package. So why some organizations, like another school that I registered recently, the woman said, the owner of the school said, she cannot afford to pay family package for married men and women as her staff. So she only register enroll them for individual for them. That is it.
So Inem, I hope that answers your question. You can register your entire staff individually, or you can, and that means that, the ones that are single, you can register them single.
Yes.
The ones that are married, you can register them single or married.
Yes.
Depending on what works for you as an SME, because I understand, as an SME, you're not making like a ton of money. I want to ask you, I want to go back to the question around payment. So say I want to register a family, but a family of 6, and at this point I don't really have all the money to pay
At once,
now. What do we do?
We have what we call pay small.
Oh, tell us about that.
Maybe semi-annual, that is a biannual, 6 months plan, 3 months plan. You can pay for it.
Okay. A 3 months plan or a 6 month plan, or you
Yes.
do a 1 year plan and you
Or you
cut
do a
it
1 year.
in bits and
No.
pay in
The
bits.
1 year now, we have a plan that is, if you cannot afford to pay once, you pay 6 months. But make sure that before the first 6 months you pay, so that you can enjoy the benefit. You renew your payment again.
Okay, so what that means, in case you didn't understand, is that you pay for your if you don't have enough money to pay 1 year, that first 6 months, it expires before the next 6 months starts. You pay for that 6 months.
So
that
that you can
allows you to
continue
enjoy the
your-
services.
Yeah, exactly.
Okay, in case you're just joining us, we have the divisional coordinator, Lagos division of Ilera Eko, Lashma, precisely,
yes.
Mr. Peter Adejo, and this is Ilera Eko on 92.7 Super FM. I have more questions. I'm holding myself as
that magnitude of people at
Yes.
once. Yeah.
Yes.
Okay.
Discounted
And
rates?
discounted rates. How are the discount?
No.
Oh, no discount.
No discount.
There's a standard fee for
Yes.
that. Is there a limit in terms of numbers of the people in the organization?
No.
That can.
There's no limit.
There's
There's
no
no
limit.
limit.
Oh, nice.
I mean, they have 600 hospitals. So places. You said Badagry. There's one
We
in
have
Badagry.
Badagry division. We have Ikeja division. We have Ekpe division. We have Lagos division. And we also have Ikorodu division. That is the 5 division under Ilera Eko.
Let's talk about sensitization, because I don't think that enough Lagosians actually know about this opportunity. So how are we trying to spread the word to them so that everyone is aware that there's an opportunity to get health insurance at very, very affordable rates?
And that's why we're here.
Right.
Thank you. So, and some of my team are outside there, moving to and fro, looking to make sure they sensitize people concerning the scheme. But we are trying to do more. We do have a program sometimes to make sure that people know about it, because as I'm talking to you now, Mr. Governor has made it compulsory and mandated to every resident of Lagos State to queue into the scheme.
Okay. So every resident of Lagos is advised to queue into the scheme.
To register under the scheme.
I really need to know this. You guys have a social media handle, right? Lashma. Remember, it is LASHMA. It's not last. It's Lashma. Okay, so LASHMA.
Well, you can join in on the conversation, send a WhatsApp message, a text message, or even call us right here, because the divisional coordinator of Lagos division of
or Ikeja. So the PS, permanent secretary, has instructed us that after the Badagry is 60 days. After Badagry, we'll go to another division for sensitization, door to door, and streets, road to road, to make sure that everybody is aware about the scheme.
Why is this important to the governor? Why is it important for everyone to be a part
under
of
the
Lashma?
health scheme?
Okay, can I borrow a statement that, like, one of my colleagues will always tell people out there and say that that the main reason why the Mr. Governor of the Lagos State, because of the love he have for his residents, he now say, because some of them are complaining they don't have money to pay hospital bill, they can't even afford to buy any drug from the hospital. You know, it's okay. My colleague will say that you're paying a change, just a chickeny change, why the government is paying the larger part of the money. So that is why I now say, instead of you to complain, you stay at home and say, I don't have.
Okay.
All right, thank you.
Let's take a call.
Hello, good morning.
Hello, good morning.
Good morning. What is your name and where are you calling us from?
My name is Chris, calling from your number.
Okay, from Yanoba. All right, talk to us. Mr. Adejo is here for you.
I just want to ask if there is
I wanted to ask if there's any plan for maintenance. That's what I just want to
Yeah,
ask.
there is a plan for
Thank
that,
you.
sir.
Okay. Thank you so much.
Tell us
What's
about
what's
that
the plan?
We have a senior plan,
senior plan. I like
for
it.
elderly people,
Okay.
or you call it 60+ plan.
Okay.
Okay. That's
So
interesting.
this plan, you can the elder is meant for elderly people. You know, their own body system is different from the younger one.
Yes.
So that's why we
Call it 60
call it
plus.
60+ or senior plan.
Okay, so how much is 60 plus or senior plan?
For now, you know, I told you earlier that Mr. Governor upgraded the plan. So
Okay.
with the previous plan, we're not using that until when PS gave us the new price for the senior plan.
That's permanent
Okay,
secretary.
okay, yeah. So right now, I mean, it used to be a particular amount of money, which we're
Yes.
not going to mention, but
Yeah,
right now,
exactly.
something is about to be done,
Yeah,
and maybe
exactly.
To help,
because
I guess.
we know how, I mean, our aged parents, the kind of things that happen to them when they're
Exactly,
older,
yes.
and so I'm sure the governor is putting in place something affordable, especially for the kids, actually
Yes,
pay for
yes,
their
yes.
parents as well.
He asked a question about single mother
mothers
plan.
Or
I think
widows.
that will be under family.
That will be under family.
Yes.
Okay.
So if you're listening right now, it's under family. Even if she's a widow, she's a
Yeah.
men as well. So if you're a widower and you have children, you are under you immediately you are eligible for that family.
People, you see, one thing you need to know in this life is that you may feel that like I have seen some parent that will come to my office and say, I don't sing. And I say, what of your children? And we don't even pray for bad things or something
course.
like that. I said, tomorrow something may happen and you may not have the money to rush to hospital. But because you are under this scheme, you have the bonus to go to that hospital. No, we say, apart from the hospital you choose. You know, I forgot. Let me just make sure this so that
Please do.
it can help people. So even if you choose one hospital and tomorrow or next you visited that your hospital, and maybe what you want to do, they don't have the facility, they can refer you to any other hospital that is under the scheme
Okay.
that has that facility, and you go there and receive your treatment.
That's a beautiful
That's
addition. Thank you
good.
for mentioning
Thank you
that.
for saying that.
So there's someone, Uche from Victoria Island, has a bunch of questions. How much is registration for HMO? I would say it depends on what plan you want to be a part of, right? So we talked about the standard JAARA plan today. So if you check from any of the offices, they will give you a whole breakdown of what expenses.
Individual
Secondly,
family.
what's the procedure for registration? Now, you've told us where to go. When we get there, what's
What do
the
we do?
procedure?
We have a form. As soon as you get it, they'll give you a form.
Okay.
You fill your detail, then they register you online.
And that's it.
And that's it. You make your payments. So as immediately they register you, that's what we call a policy number.
Okay.
Just like, let me use BVN as an example. In
Okay.
the bank, if you go to bank today, they will say, do you have BVN? If you don't have BVN, they will now generate BVN for you. So we have what is called policy number. Immediately we register you and we submit it. The next thing that will pop up is the policy number, and that is what you will use.
Okay.
But you must make sure and make payments on or before 25th of the correct month so that you can access care by the following months.
Okay. Okay.
So if you register, you take that policy number. As soon as your policy is active, you take it to the hospital.
And
The only thing that you
register.
need to do is just to tell them that you're under this scheme. And they will ask you for the policy number. As soon as they enter the policy number into their system, your information will pop up. The next thing they want to confirm is to know whether you have made payment. If you have made payment, it will be showing active then. But if you have
Okay.
not made payment, it will be showing pending until when you make payments. So that is all. Very
That's
simple as
interesting.
that.
He has more questions. So he said, how is it possible I can include my brothers and sisters just above 23? They are above 23.
They
So,
should go for
the individual. Yeah.
Or if they are married, they should register
As a
as a family.
What is the help I can get in case of major surgery? We've told you.
So how
it
can Ilera Eko
differs.
cushion the effect?
Okay,
Yeah.
we have a customer care number that you can call, and that is why if you have any issue, if you're under Ilera Eko, you have any issue, if you visit any hospital you choose during registration and you have any issue, call. Don't leave the hospital before calling us. Make sure you call the
Okay.
customer's care right there so that they can speak with the hospital management.
And sort it
And
out.
we have a representative in each hospital to know what is the problem. So if your own case, maybe if you call the customer care and what you're trying to do is not cover or is not under the scheme, they can tell you, no, this does not cover.
So even if it does not cover the scheme, right?
Are there options?
Are there options that Ilera Eko can do? Is, okay, you know what? This minor surgery costs this, but we're going to cushion the effect by you paying an extra amount of
That
money.
will be discussed by the customer.
By the customer
Depending
care
on the
service
situation.
person. Okay.
Yes.
This guy has a ton of questions. Okay, so he's asking again for the customer care number of
Ilera
Lashma,
Eko.
Ilera Eko particularly.
And it's not just any HMO. It's actually by Lagos State.
Exactly.
Yeah, it's not just any HMO because it's the Lagos State Management Agency that is putting this together for Lagosians. So the governor, in his good mind, decided that, you know what, we need to do this for every resident in Lagos, and everyone is advised to key into that.
So and then he talks about, you know, how do I get the list of, and that's a good question. How do you get a list of hospitals in an area? For instance, he stays around Alimosho, Ayobo, Alimosho local government area. How do I know the list of hospitals available to Lashma or to me through Lashma?
Oh, that is why I said I can visit our website by visiting Lashma, www.lashma.com. Notwithstanding, before I leave here, I'll drop my contact number.
He's even requesting your contact details as
Yeah.
well. Yes.
Well, he will drop his email address here, but his personal number, do you want to drop your personal
Yes.
number?
Okay.
Problem.
Fantastic.